If you're a guy over 40 and you're noticing things aren't working quite like they used to downstairs, I need you to hear me out. Most men won't like what I'm about to say, but the truth is this: your penis isn't just a plumbing problem. It's more like a muscle that's been neglected at the gym for decades. And if you don't start training it the right way, erectile dysfunction isn't just a possibility. It's almost inevitable. Here's the deal: this sneaky problem doesn't just hit out of nowhere. It creeps up while your energy drops, your hormones shift, and your blood flow slows down. By the time most guys notice it, they've already missed a huge window to fix it naturally, without pills, without gimmicks, just smart, simple exercise. If you're ready to finally take action and reclaim your performance, stick with me. Because today, we're talking about the single best exercise that can actually stop erectile dysfunction in its tracks. I'm Dr. Camilla Hayes, and I've spent years helping guys over 40 get their energy, confidence, and sexual performance back on track. I work with men who thought their best days were behind them, the ones feeling frustrated, embarrassed, or just plain off in the bedroom. And we fix it naturally, without relying on quick fixes or pills that only mask the problem. I know what it's like to feel that creeping anxiety when things don't work like they used to. And more importantly, I know how to turn it around, because I've seen it hundreds of times. I help men rebuild their hormones, boost blood flow, and strengthen their sexual health the right way, from the inside out. This isn't theory or guesswork. This is real, practical, doctor-led guidance for men who want to feel strong, confident, and fully alive again. All right, here's what we're going to cover today, and trust me, you'll want to stick around for all of it. First, I'm going to break down why erectile dysfunction actually happens in men over 40. It's not just about age or stress like most guys think. Then, I'll show you the single best exercise to strengthen your penis and restore performance. Yes, you can actually train it like a muscle. We're also going to talk about the hormones, blood flow, and lifestyle factors that sneakily sabotage your performance without you even noticing. Plus, I'll share a real-life story of a guy just like you who turned things around. It's the kind of story that'll give you hope and practical takeaways you can start using today. And stay with me until the very end, because I'm going to bust some myths most guys have been believing for decades. Stuff nobody tells you, not even your buddies or most doctors. By the time we're done, you're going to know exactly what works and what's holding you back. All right, fellas, before we jump into exercises and hacks, let's talk about why this topic even matters, and why erectile dysfunction sneaks up on so many guys over 40. You've got to understand this part, because if you don't, nothing else I say will really stick. Here's the deal. Most guys think ED is just a plumbing problem, that the penis stops working because, well, it's old. That's not entirely true. What's really happening is that your body is changing in ways that silently affect blood flow, hormones, and muscle function. Think of your penis like a car engine. You can't just blame the gas tank if the engine's clogged or the spark plugs are worn out. You have to look at the whole system, and that's exactly what's going on inside your body. As men hit 40 and beyond, testosterone naturally starts to decline. That hormone acts like the spark plug for your sex drive, your energy, and even your mood. Lower testosterone isn't the only culprit, though. Blood flow also slows down. And remember, erections are basically just your body flooding a muscle with blood. If your arteries are stiff or your circulation is sluggish, you're not going to get the same results as you did in your 20s. Add in other factors like stress, poor sleep, inactivity, and even subtle lifestyle habits, like sitting too much, eating processed foods, or skipping strength training, and you've got a perfect storm. That's why ED often shows up out of nowhere. One day you're fine, and the next, things just aren't firing like they used to. And trust me, it's not because you lost your mojo. It's your body telling you it needs attention. Now, here's another thing most men miss. Erectile function is literally a muscle performance issue. That's right, your penis responds to exercise just like any other part of your body. But the problem is, most men never train it. They think pills or supplements are the only answer. They ignore blood flow, the pelvic floor, and even the small but critical muscles that actually make erections possible. It's like trying to bench press without ever working your chest. Eventually, you're going to hit a wall. So, What I want you to take away from this part is simple. ED is rarely just age. It's a combination of hormonal shifts, declining circulation, and underused muscle systems. And the good news? All of that can be improved with the right approach, the right exercises, habits, and mindset. You don't have to accept it as inevitable. You just need to know what to do and how to do it consistently. All right, now that we've got the background and you understand why this matters, we can get into the heart of it, the actual exercises and strategies to start reversing ED and getting your performance back. First, strengthen your pelvic floor muscles. Look, fellas, this is the big one. Most guys over 40 have never even thought about their pelvic floor, but these muscles are the foundation of every erection. Think of them like the suspension system in a car. If it's weak, the ride, or in this case, your performance, is going to be shaky. When you strengthen these muscles, you improve blood flow and erectile rigidity. Here's what's happening inside. The pelvic floor muscles support the base of the penis and help trap blood in the tissue during an erection. If these muscles are weak, blood leaks out too quickly, and that firmness just isn't there. Most men think Kegels are just for women, or that once you hit 40, it's too late. That's wrong. Start simple. Squeeze the muscles you use to stop urine midstream. Hold for 3 to 5 seconds, release, and repeat 10 to 15 times. Do 3 sets a day. Over time, you'll notice stronger control, better stamina, and yes, harder erections. Don't overthink it. Just commit to daily practice. Second, improve your cardiovascular health. Here's the deal. Erections are 100% about blood flow. If your heart and arteries aren't healthy, your penis isn't getting the oxygen it needs. This is why ED is often one of the first warning signs of heart disease. Your body literally prioritizes other organs over your penis when circulation is sluggish. Most guys think walking a few steps here and there is enough cardio. It's not. You need to get your heart rate up, even if it's just 20 to 30 minutes of brisk walking, cycling, or light interval training a few times a week. Better circulation equals stronger erections. Simple math, right? Here's a quick example. A patient of mine, Steve, 48, had borderline hypertension and mild ED. Once he added regular cardio, his blood pressure dropped, energy spiked, and his bedroom performance came back without a single pill. Cardio isn't glamorous, but it's non-negotiable. Third, optimize testosterone naturally. Now let's talk hormones, because they're the silent drivers behind your libido, energy, and performance. Testosterone naturally dips after 40, but lifestyle choices can accelerate that decline. Low T isn't just about feeling tired, it directly impacts erectile function, motivation, and muscle mass. Most men think testosterone replacement therapy is the only option. But here's the truth. Natural strategies work if you commit. Lift weights, get good sleep, manage stress, and eat enough protein and healthy fats. Squats, deadlifts, and resistance training trigger testosterone surges, which support your sexual health and overall vitality. Here's the kicker. Even a small increase in testosterone can significantly improve energy and performance. That's why guys who focus on strength training often report feeling 20 years younger in the bedroom. Fourth, focus on nitric oxide and blood flow nutrition. Blood flow isn't just about your heart, it's also about your arteries' ability to expand. Nitric oxide is a key molecule here. It tells your blood vessels to relax, allowing more blood to flow where it counts. And here's the truth most men miss. Your diet can make or break nitric oxide levels. Eat beets, leafy greens, and foods rich in L-arginine or citrulline. Stay hydrated. Avoid excessive sugar, processed foods, and alcohol that damage your endothelial lining. Most men think ED supplements are magic, but without supporting blood flow nutritionally, they're just temporary fixes. Practical tip: add spinach, arugula, and watermelon to your meals. It's simple, effective, and it boosts nitric oxide naturally. Fifth, train the penis, like a muscle. Here's where most men get really curious. Yes, your penis can be trained. The key is specific exercises that improve blood flow and tissue health. I'm talking about controlled stretches, jelqing, done safely, and pelvic floor coordination. Why it works. Erections rely on spongy tissue that fills with blood. Just like any muscle, tissue that's underused becomes weaker and less responsive. Think of it like a bicep. If you never lift, it shrinks. Same thing happens down there. Start slow, focus on technique, and commit a few minutes a day. Over weeks, you'll notice firmer, longer-lasting erections. Most men think only medications help here, but consistent exercise beats pills in the long term. Sixth, manage stress and improve sleep. Stress kills erections, full stop. Cortisol, your stress hormone, directly suppresses testosterone and constricts blood vessels. Poor sleep compounds the problem. Deep REM sleep is when testosterone peaks, and if you're tossing and turning or only getting 5 to 6 hours, your performance suffers. Most guys underestimate this. They'll work out, eat right, and still feel off because stress and sleep aren't addressed. Daily habits matter. Aim for 7 to 8 hours, keep your bedroom dark and cool, and consider meditation or breathing exercises. Even 5 to 10 minutes a day can make a huge difference. Seventh, avoid common mistakes most men make. Finally, let's clear the record on mistakes that sabotage progress. Number 1, relying solely on pills or creams. These don't fix the underlying problem. They just mask it. Number 2, ignoring lifestyle factors like diet, weight, and alcohol. Number 3, thinking it's just age and giving up. Here's the truth. Most men over 40 who commit to exercise, hormone support, blood flow nutrition, and stress management see dramatic improvements in 8 to 12 weeks. It's not magic. It's just consistent, targeted action. Let me tell you about one of my patients. I'll call him Mark. Mark was 52, married, with 2 teenage kids, and a busy corporate job. He came to me feeling frustrated, embarrassed, and honestly a little hopeless. He told me, "Doc, I just don't feel like myself anymore. My energy is shot, and my erections, well, they're not reliable." We dug into his lifestyle, hormones, and daily habits. Mark was overweight, stressed out, drinking a bit too much on weekends, and skipping the gym for months. His testosterone was lower than average, and his blood pressure was creeping up. But here's the thing. He wasn't broken. He just needed a roadmap and consistent action. I recommended a multi-step approach. First, we started with pelvic floor exercises and targeted strength training to rebuild his muscle foundation. Then we addressed his diet to improve blood flow. More leafy greens, beets, and lean proteins, less processed junk. We added regular cardio, better sleep routines, and some simple stress management techniques. Within about 8 weeks, Mark noticed huge changes. His energy was back, he felt more confident, and most importantly, his erections were firmer and more reliable than they had been in years. He even joked, "Doc, I forgot what this felt like." The core lesson here is simple. ED isn't a life sentence. Even men in their 50s can turn things around naturally with the right combination of exercise, nutrition, and lifestyle adjustments. Mark's story shows that commitment, even just a few key changes, can completely transform sexual performance, confidence, and overall well-being. All right, let's clear up some of the biggest myths that most men over 40 believe, and that honestly keep them stuck. Myth number 1, ED is just part of getting old. This one drives me nuts. Look, your body does change with age, yes, but ED is rarely inevitable. Most guys just aren't addressing the real issues: weak pelvic floor muscles, poor blood flow, hormone imbalances, stress, or sleep problems. Believing it's normal for age just keeps men from doing the things that actually work. Myth number 2, pills are the only solution. Here's the truth. Medications like Viagra or Cialis can help temporarily, but they don't fix the underlying problem. Relying solely on pills is like putting a Band-Aid on a leaky pipe. Without improving circulation, hormones, and muscle function, you're just masking the issue. Real lasting results come from exercise, nutrition, and lifestyle adjustments. Myth number 3, it's all in my head. Stress and anxiety can make things worse, sure, but most ED isn't psychological, it's physical. Circulation, hormones, and muscle control. Thinking it's just mental makes men feel ashamed and prevents them from taking real action. Once you address the body, confidence comes back naturally. Here's the part nobody tells you. Not your buddies, not the internet, and not most doctors. You actually have a lot of control over this. Targeted exercises, better nutrition, and consistent habits can dramatically improve performance, even if you've been struggling for years. Understanding the truth behind these myths is the first step toward taking back control. All right, fellas, let's quickly recap everything we covered today so it sticks. First, strengthen your pelvic floor muscles. They're the foundation of every erection. Second, improve your cardiovascular health. Better blood flow equals better performance. Third, optimize your testosterone naturally. Lift weights, sleep well, manage stress. Fourth, support nitric oxide and blood flow with nutrition. Eat leafy greens, beets, and stay hydrated. Fifth, train the penis like a muscle. Targeted exercises improve tissue health and rigidity. Sixth, manage stress and get quality sleep, because hormones and blood flow are deeply affected. Seventh, avoid common mistakes. Don't rely solely on pills, ignore lifestyle, or accept ED as just age. Do these consistently, and you're giving your body the best chance to restore performance naturally. If you're a guy over 40 and ready to take action, here's what I want you to do next. Hit that like button if this video gave you real value, and make sure to subscribe to the Diabetes Health Clinic channel so you don't miss any of my tips on hormones, energy, and sexual performance. Drop a comment below and tell me, which of these strategies are you most excited to try? Or if you've already been struggling with ED, I want to hear your story. Your experience can help other guys feel less alone. And don't forget, I've got a free guide packed with exercises, nutrition tips, and step-by-step strategies to naturally improve your erections. The link is right in the description. Grab it and start taking action today. Remember, it's not about quick fixes. It's about consistent, smart steps that actually work. You're not alone, and you're not broken. ED is just a signal from your body that it needs attention. And the good news is, you can take control. I'm Dr. Camilla Hayes. Stay strong, stay healthy, and keep taking those steps to reclaim your energy, confidence, and performance. I'll see you in the next video.